have some customer assessment course objectives. So in this chapter, you'll be able to learn the following. How to identify a customer expectations and concerns. The confidentiality, emotional, spiritual care. How to identify clinical concerns that the patients may have. How to identify the financial concerns that a patient and or their family may have. Arrange customer literacy and comprehension services, interpreter services, and of course that meaningful use data. Identify tools and KPI, key performance indicators to measure customer experience. Let's look at the terminology. We'll be looking at the definition of meaningful use, HCAHPS, key performance indicators, a communication technique called HEAT, electronic health records, effective listening, preferred language, patient satisfaction surveys, quality improvement initiatives, and benchmarking. All right, so let's take a look at the definition of meaningful use, or MU for short. So it's an incentive program that was established to give providers some money for adopting meaningful use and healthcare information technology and to adopt qualifying electronic health records. So if you're out in patient access already, you're probably familiar with a couple different names of EHRs that you might have worked with or heard other people working with, which is Epic, Cerner, Allscripts, Meditech, and that's just to name a few. The list goes on and on of different EHRs that you could possibly be using. But we have to remember that we weren't always using an electronic health record system or a computer to do our data entry. Some of this was actually done old school, like, hey, we were using paper charts. Some offices might still be using paper charts. But in order to get everybody on board with adopting this new technology of doing things in a computer system, the government decided to create a meaningful use program. When we had to wave that little carrot in front of the provider and the hospitals to say, hey, we're going to give you some money. That's the incentive for flipping out of those old paper records and actually doing things in the 20th century, which is like using a computer to capture all the data. But not only that, we want to be able to capture our patients' data and we want to be able to share that with other providers. So that was stage one. Stage two is advanced clinical processes. Again, we want to make sure that we have a standard process. So if you go to hospital A and hospital B, that everybody's doing the right thing the right way all the time, and they're able to transfer that information because everybody's doing things the same. All of which adds up to stage three, which is collecting all of this data, making sure that we get improved clinical outcomes because we have standardization, because that information from your doctor's office is now flowing to the hospital about you, the patient, and therefore that's going to end up being a very cohesive patient file from your every single time you had a test, from every diagnosis that you got, from every time you had an x-ray. And of course, that's all going to hopefully lower cost and improve your clinical outcome, improve your health. That's the goal of meaningful use. HCAHPS, also known as Hospital Consumer Assessment of Healthcare Providers and Systems. It's a standard survey of hospital patients, and it captures the patient's unique perspective on the healthcare that they were provided. And the information is also provided to the public so that you compare the information between hospital A and hospital B. Think of HCAHPS as like a report card for hospitals. KPI, or key performance indicators. Now, key performance indicators aren't exclusive to healthcare. There are many other industries that have a KPI. So the definition of a KPI is that quantifiable measurement used to evaluate the success of an organization in them meeting their objectives in regards to their performance. So creating KPIs, there are 5 steps to the process. 1, establish a clear objective, outline the criteria, collect the data, build your formulas, and then present your KPI. Heat. Heat is a communication technique used to diffuse situations. The method for taking the heat. The H stands for hear or listen to your patient or your colleague or your doctor or your nurse or whomever. The E is to empathize, to understand the feelings that someone is experiencing. The A is to apologize. I'm sorry for the long wait. The T is to take action, take responsibility, and do something to resolve the situation. Electronic health record, EHR. It's a real-time digitized version of the patient's medical history. That allows secure information to be accessed by authorized users. The EHR goes beyond a single provider and can contain shared information from multiple providers to develop a comprehensive patient history. So what does this mean? So basically, as we had stated before on our meaningful use slide, this is getting everything it used to be on paper converted into an electronic system. So the information is cohesive and creates a story of the patient's medical care and treatment. And everything is stored electronically and not on paper. There are many facilities that are striving to become completely paper-free. But in actuality, they're probably more paperless, meaning less on paper, than they are completely paper-free. Effective listening. Actively absorbing the information that the speaker, patient, or the patient's family, or whomever you happen to be engaging in conversation with, is telling you. To be able to provide the speaker with feedback and acknowledgement of you receiving their message. A way to display that you are actually effectively listening is to repeat back to the person who is speaking your summary of what they're trying to express. Preferred language. This is the language, which also includes sign language, that the patient prefers to receive their medical communication in. This particular field or data capture of preferred language meets the requirements from MU. Patient satisfaction surveys. So these surveys are an assessment of the patient's experience while they were receiving their medical care. The patient is going to give a ranking or performance indicator, and those surveys can be given out by HCAHPS, Press Ganey, and JD Powers. So then the example that I show here, we're looking at the emergency room, and some of the touch points have to deal with the waiting time before they were noticed, the helpfulness of the first person that they encountered, the comfort of the waiting area, the waiting time to sit there before they were actually treated, and then the wait time to actually see a doctor. And then the list goes on. Quality Improvement Initiatives, or QI. It involves the systematic activities that are organized and implemented by the organization to monitor and assess and improve quality of health. An approach to the study and improvement of the processes of providing healthcare services to meet the needs of the client. Benchmarking. Benchmarking is a formal comparison of the quality of service or productivity, customer satisfaction, costs with similar functional groups to improve the process or performance. So in my little mock-up here, I'm comparing the medical unit, comparing it to the surgical area, the emergency room, in our labor and delivery area. And the categories that I want to quantify or see exactly how they're performing is to look at cleanliness, quietness, and attentiveness. So you can see in my mock graph that there are certain areas that are doing much better in the category of, say, attentiveness, and others that aren't doing as well. And so we want to look at why those particular areas are doing quite well in a particular category and figure out, are there some strategies, resources, or tools that we could apply to the other units in order to improve their success, their process, and their performance.